Good afternoon. Today's Tuesday afternoon, day 2 of our 65-day and older vaccine site here in Lee County. Overall, this is a statewide operation that Lee County is supporting. Mobilization of the vaccine site has been an organization-wide effort. Overall, it's been a real success. This and Lee County residents with a Florida-issued registration come and stand online. Other counties will be distributed the vaccine in upcoming days, and residents in counties should access services in their county and the residents where possible. However, no one will be turned away who meet the requirement of 65 and older. The second dose of Minerva should be received 28 days after the initial dose. You cannot mix and match pharmaceuticals. If you get a dose, here we go north, and don't try to get a different one. Be respectful of people. If you stand in line and you know you're not going to be here in 28 days, please don't ask for any vaccine. To expedite this process, go online, go on legov.com/vaccine and print the Minerva consent form. United Way 211 is also there to assist in any questions you might have with this. Some numbers to update you all. Since the vaccination arrived in Lee County, the number of shots administered by DOH and healthcare workers over 65 as of this morning is 932. Monday at Estero, over 630 shots were administered. Today's rundown in Benita, over 800 shots were administered and completed. Lehigh Acres, 600 dosage and completed. Fort Myers Sports Complex, 600 doses have been completed. How today worked. As we continue to understand, this is a fluid situation. 3 vaccine sites will fully reach capacity by 7 a.m. today, Because capacity was reached, the number of vaccinations allocated to the site were assigned. The sites were not accepting anyone else this afternoon. The sites will finish vaccinating those people that were in line for capacity. Once it's reached, we'll close for the day. The site's originally scheduled for the morning and afternoon sessions. Coming up, what changes are we making in tomorrow's sites in the future? We'll have greeters, we'll have portals, we'll have social distancing markers, line control measures, continued use of numbering stations. Lee County IT is evaluating tech options for the potential reservation system. The goal was set the vaccinations in people's arms as soon as we had them. Let's understand that was our number one objective, to get people vaccinated as quickly as we could. The state releases the schedule for additional vaccine sites within this week. I'll actually pause now and answer some questions.
Commissioner, your opening statement referred to this county, people working from Lee County coming here. And if I understand it correctly, that they will be served if they're here, but they're encouraged not to come.
We're asking them not to come, but obviously it's a federal program, so we can't turn away anyone that's online. It's over 65. Some of the counties have run into significant problems with crashes in their website. So obviously we want to make sure we have the bandwidth. We want to obviously go through logistics. We're working with IT right now to make sure we address those issues. So when we roll this out, it's successful and not necessarily just quickly getting out a website and not having it comply.
Are there any plans to create a separate line for healthcare workers who want the vaccine but can't wait for hours at a time?
Good afternoon. We're actually doing some ancillary sites for our healthcare workers because we do recognize as they're working, they can't run over during their lunch hour if we're already at capacity. So we are working with some of the practices. We actually were at a large practice in Fort Myers this morning doing some vaccination for healthcare workers. So that's how we're handling that.
Can you tell us why the number of vaccines is changing? Yesterday we heard 300 and more people got vaccinated, which is great. But
Sure. We absolutely were not expecting to have 1,000 people lined up by 7 o'clock this morning in Benita. And so we increased the number of doses that we had allocated for that site because we felt it was only fair that we do so. But it's truly contingent on the supply, and as you know, from a national perspective, that supply chain is relatively uncertain right now.
Do they expect to see that as the sites go on?
I think as you see the manufacturers, the production increase, and additional pharmaceutical companies come online, there are other pharmaceutical companies that are seeking EUA approval for their vaccinations. That supply chain is going to get better, and then I think you're going to start to see it in your pharmacies and primary care physicians as well. So.
And then can you tell us a little bit more about, I know you wanted people to stay in their areas, and that's kind of why they have these changing locations. Is that the thinking behind it?
That's correct. We're trying to make it convenient for people so they can stay in close proximity to their home area. And that's why, we've been moving the sites around a little bit and playing with them to try to, accommodate people so they don't have to drive clear across the county and are served right in their neighborhood.
Is there any plan to have one location that people can go to?
We are exploring all options at this point to try to, get the best fit for the public and for all the agencies involved in executing this, efficiency purposes and so on and so forth. So that's why we did this a week at a time. This gave us a chance to feel this out, try it out.
Being used every day? Is it all going to the distribution points, or are you giving some rationing like that?
So we had an allocation of vaccine, and we have to get that into the public's arm as quickly as possible. That requires clinicians to do so. So we are pushing out as many doses as we can a day with the clinicians that we have to put vaccines in arms.
So the ability of people that are handing it out of the shots to
Correct. And understand it's a complete process. It's a federal program, so there are custody chain issues where you can't just hand the vaccine to anybody to start vaccinating. So we've employed things such as paramedicine agreements with our Lee County EMS partners, Cape Coral Fire partners, to be able to assist us with the vaccination. And then, of course, Lee Health has vaccine that they're vaccinating their staff with. So it's a whole process. It's not just putting shots in arms. There's the registration piece and Florida shots piece that goes with that.
Additionally, I'm going to have our sheriff give you some of the logistics that obviously he's responsible for, just so you have an understanding of the magnitude of what we're dealing with. Sheriff?
Thank you. Thanks for being here today. I want to first start off by thanking our governor, Governor DeSantis, who the reason is that we got the vaccine because of our governor. He's done a phenomenal job during this pandemic. And most importantly, he's protected those that are most vulnerable, 65 years and older, our front care, healthcare workers, people that are most vulnerable. He protected, and Governor, we thank you for that. I want to thank our team here, our County Manager, Roger DeJarlais, our County Commission, Department of Health. This team has been unstoppable. They are together. We communicate 24/7. The governor and his chief of staff, we just spoke to minutes before we walked out here. They're continuously calling and checking on us, and we're very thankful for that cohesive relationship that we have throughout the state. I want to also say that overall in this county, as the chief law enforcement officer that's responsible for safety and security, we have one of my family members here at the Emergency Operations Center who works cohesively with each and every partner here. And there was a report of, quote, chaos in Lee County at our facilities here, and I will tell you, I am briefed continuously. My chain of command is briefed continuously, and that is absolutely not true. That is not a fact. Matter of fact, I want to thank the great residents of this county who went out, they got there early. They have done everything they can to be a part of our team, and things have run so smoothly in this county. I'm very pleased and thankful that the residents have been part of this team, and things have been very, very smooth with no major issues. again, things will change. The number of shots may change. But I can tell you, our deputies, our manpower, we're 24/7 around the clock. We're at every single site. And we've had no major issues at all. I'll also tell you the eye in the sky that I call it, which is our Skywatch Tower. That Skywatch Tower is deployed at every single site, and it's live. And that is being monitored by my real-time information center, which then communicates directly with deputies on scene. So again, everything that we are doing is working. And it's because of the team in place, and the residents play a huge part of that team. So I'm very thankful. We're moving forward. I want people to relax. Just relax and understand that we are going to help you. And in the end, we're all going to be great, and things are going to be one team, and we're going to make certain that people get what they need. It's just being rolled out as we speak, and it may change a little bit from time to time. But overall, we're very pleased at every angle of what we've done. This county's done a great job, and thank you. Thank you for being here today.
Sheriff, can you talk a little bit about how you're doing culture and maybe like making sure everyone at those sites that are lined up hours ahead of time are safe? Talk a little bit more in detail.
So the question is how my deputies are handling people on site and people that get there early?
Yeah, lined up hours and hours.
Absolutely. So we realize people get very stressed out, and they want to make certain they're going to get the vaccine. So people show up very, very early, okay? Realizing that, our deputies are working around the clock at every single site. And that interaction, making certain people are safe, that they're lining up, and more just the presence. Again, people have been great. This county's filled with great residents, and they're working with our deputies to make sure that we get them where they are, get what they need, and again, coming prepared. If they have medication, if they need liquids, depends on the weather, if they need to dress warm or whatever is presenting itself. And I got to tell you, they've done a great job, so we're very thankful.
Sure, but the official advice now is
So the question is the official advice to get there as early as possible? That's no. I mean, we want people to arrive on time, and to coordinate your efforts, but most importantly, listen to the deputies on scene, because each site we're working is very individualized, and we want to make certain that at each site we're handling it very specific to that site. And again, we've had no issues. People have been great. They've worked together, and we've been very pleased with the results. Any other questions? Thank you.
Well, we appreciate you coming out today. I think it's really important for us to understand it was just 9 months ago where this pandemic was put on our doorstep. 9 months later, we're actually administering vaccines. Who would ever thought that we were able to do that as quickly as we did? The team here, honestly, every issue we have to come across is really worked out, logistically talked out, vetted, re-vetted, and then implemented. Again, the objective is to try to get vaccines to people as quickly as possible. We'll continue to become more fluid on this. We'll continue to make adjustments, and we'll notify you accordingly. Thank you very much.
Can you tell us a little bit about how homebound residents make it
I just want to make one more point too. We rely on each other here in this county, as you can see at every level, and we're relying on you, the media, to help us get this message out. So the information that we provide you today, help us get that information out and let the people understand things are running very, very smoothly here. We're very, very pleased. And tomorrow's another day, and we will continue to work together as one team. So please, the more factual information that gets out, it's important to us.
We're aware of the people that obviously have ADA issues, people that are home. We're developing a strategy to obviously make sure we address those issues as well. Again, it's day 2, so we're trying to do the best we can, working through the various systems we have to make sure we address those issues.
And then just if you could tell me a little bit about the people who are in wheelchairs or in walkers, things like that. We saw them out there and said you guys are helping them. Can you tell us a little bit more about it?
Basically, we're trying to come up and address and identify all those people that obviously have needs, and then obviously how we implement and address those issues. Thank you very much.